Hello, everyone. We're ready to get started. We're so glad that you could join us today. My name is Julie Didkowski, and I'm one of Skyland Trail's 5 National Referral Relations Representatives. I've been with Skyland Trail for over 17 years and live in Atlanta, not too far from the Skyland Trail campuses. Please feel free to reach out to me if I can be of assistance in any way. Our experts are going to provide a very comprehensive overview of our programs and services today. I'd just like to share one brief update. Both our adult and adolescent programs are now in network with most private insurance, as well as TRICARE East. As a nonprofit, we do offer some need-based financial assistance to help families cover the cost of programs. I also wanted to ask one favor of you all. If you would please put any questions you have throughout the presentation in the Q&A box, we will be able to address them that way. And we are recording today's presentation, which will be available on our website at skylandtrail.org. Thanks so much for joining us. And it is now my pleasure to turn it over to Nicole Murphy. Nicole is our Director of Admissions at Skyland Trail. Thank you.
Hi, everybody. Welcome. I just wanted to give a little bit of an overview of Skyland Trail's programming, and then we'll kind of dig deeper into treatment of older adults at Skyland Trail. As Julie mentioned, we're a nonprofit. We're a primary mental health treatment in Atlanta, Georgia. We have several different levels of care. I would about 80 to 90% of our clients will start in our residential treatment for about a month and a half to 2 months, and then transfer into our day treatment and then into our IOP program. When they're in day treatment or IOP, they're in some sort of supportive living. So that can be sober living in the community or our transitional housing. There are some clients that will admit straight into day treatment and live in the Atlanta area, or when they're transferring into the day treatment, will live in the Atlanta area. We also have some outpatient treatment here too, which includes TMS. TMS can be done while in our kind of continuum of care, but it also can be done as an outpatient service, as well as our vocational services that is definitely done in part of our programming here, but can be done in outpatient too. We're mainly going to be talking about our adult program, but I'm going to quickly talk about our adolescent campus because we do have an adolescent Skyland Trail. Clients there are from the ages of 14 to 17. It is a separate campus that's about 3 to 5 miles away from our main adult campus. Clients there have to start in our residential program and then move into our day treatment program. Our teens have a diagnosis mainly of mood disorders and anxiety disorders besides OCD, and also kind of mood instability, self-harming behaviors, and just unhealthy kind of interpersonal relationships too, or at our adolescent. However, today we're going to talk mainly about our adult campus. As I said, we have that kind of continuum of care. We treat clients who are 18 and older with mood disorders such as bipolar, major depressive disorder, anxiety disorders, again, except for OCD. We also treat clients with thought disorders such as schizophrenia, schizoaffective disorder. We have kind of specialized programs for each one of these diagnoses, including borderline personality disorder, which we'll kind of discuss later on in the presentation. And then we do have clients who might have a history of substance abuse, might be self-medicating with substances, and we have a specialized kind of dual diagnosis programming that can be added to our other programming. Today you're going to hear about kind of what I consider all the different pieces of the puzzle that makes up a client here and how they interact with programming. So what I mean by that is that clients will have a psychiatrist that we're working on medication. we are doing individual therapy. We're doing a variety of different groups that will include coping skill groups, insight building groups, relationship groups, art and music therapy. We have vocational services that are incorporated, as well as our wellness clinic. Kind of, again, looking at all the pieces of the puzzle that makes a person up and how we can kind of work in all these many disciplines that we have here. Everyone how the day is that we have a main campus where everyone's coming for group and individual therapy, but we have two residential campuses. One is our Rollins campus, which is for our clients 18 to typically 23, 24. It is set up more like a dorm on a college campus. Both how the physical look of the building, as well as the activities and the community there is definitely more focused for kind of college age clients. With our South residents, which we're going to be talking more about today, that is clients 24 and above. Average age at South is probably 35, around 35 to 40 years old. There's a variety of different kind of where people are in their lives in this age group, but they are at South Campus together, kind of creating a more older, mature community there. A lot of our clients in this kind of age group are going through some sort of transition in their lives. So we see clients who might be in the process of divorce or have a recent divorce, recent death, recent change in their career, either by their choice or not their choice, but some sort of kind of real change in what is going on in their lives. So we're going to kind of move to our other presenters. Our next one up is Dr. Meadows. He has been a psychiatrist at Skyland Trail on the clinical side, so treating our clients typically on our cognitive behavioral therapy track, as well as our dialectical behavioral track. Recently, he's moved into our medical director of admissions, which is exciting for me personally, because I get to work with him on a daily basis, which has been very exciting. But he's going to talk a little bit more about kind of treatment of this older adult population that I've been talking about.
Great. Well, thank you for those kind words. I appreciate that. And good afternoon, everyone. I'm excited to be here, and I appreciate you all taking time out of your schedule to join a thoughtful approach to the care of those individuals. I'll be sharing a little bit about psychiatric services as it relates to medication management and TMS. Work toward diagnostic clarity and also manage medical issues. So for the first piece, when we think about evidence-based medication management for older adults, at the time of admission, each client is seen by a psychiatrist for a full comprehensive evaluation, at which point we are reviewing history, reviewing previous treatments, reviewing their current medications, as well as comorbid medical issues. And we appreciate that medications are an important piece of the psychiatric care, but at the same time, only a piece. And certainly, we think about medications in a larger context of the broader treatment when it comes to also focusing on psychotherapies and behavior change and supporting clients and families in a holistic way. One of the things that I've appreciated about how medication management occurs at Skyland Trail is that, particularly for older adults, oftentimes we are looking toward possibly fewer medications than what they initially come in on. One of the things that we know is that as people age, oftentimes we see comorbid medical issues and subsequent medications used to treat their other medical conditions. And so we want to be mindful of a condition that we call polypharmacy, meaning when individuals are on multiple medications that have risk of interactions or side effects, that can at times, unintentionally do more harm than good. And so we want to take a mindful approach toward rational and kind of thoughtful medication selection. And for older adults, really thinking about two things: improvement or functional stability. And the second would be um, minimizing or trying to decrease cognitive related side effects. I've worked with a number of adults who are working professionals and have families and are still in the midst of raising children, and so they are understandably, hesitant regarding medications that could impair their function at work or cause side effects such as, sluggishness or confusion or excess fatigue. And so those are things that we are really getting into the details around with the medication selection and being thoughtful on which options are the best fit and what's the least amount possible that we can use at the appropriate dose to provide relief, but not create additional side effect burden. As a non-medication option, we offer TMS, transcranial magnetic stimulation, here at Skyland Trail. That program is run by Dr. Hunter, one of our psychiatrists, and we've been doing it here for, I think, a little over 6 years now, seeing very good results. TMS is a non-invasive procedure that's designed for the treatment of what's called treatment-resistant depression. So if individuals have experienced depressive symptoms that have not fully improved with medications or therapy alone, we can look at TMS as an adjunct or as an add-on to the medication treatment. And particularly for older adults, I've heard a lot of promise about TMS and a lot of benefit from that procedure, and it's well tolerated to their medication regimen that they have to keep up with, and there's no systemic side effects from it since it's not anything that's going into the body. It's a very, again, kind of focal and localized treatment that is well tolerated and can be a nice alternative option to having to consider more medication. With regard to diagnoses and making sure that we have a complete understanding of patients and that they are assigned to the appropriate psychotherapy tracks and the appropriate medication plans, in addition to the comprehensive assessment that we do at admission with the psychiatrist, we also offer comprehensive psychological testing through our psychological services department. And so oftentimes, particularly in the transition from younger adulthood to older adulthood, things can change. And we know that presentation of mental health disorders can change, and also new onset mental health issues can occur later in life. And so we really want to take a very thoughtful approach to making an accurate diagnosis and having the appropriate treatment plan for the full breadth of the diagnoses that our patients experience, and allowing them to leave this treatment program with a report, with a comprehensive analysis of their mental health that they can share with future providers, and can really be helpful in decreasing some of the guesswork and some of the trial and error that could happen otherwise. And then lastly, when it comes to managing other medical conditions or physical health concerns, we are very fortunate here at Skyland to have an on-site primary care clinic known as the Glenn Family Wellness Clinic. And we work very closely with them in collaboration for management of our patients' medical issues during their length of stay. And so all patients, when they first come in, will complete a comprehensive history and physical examination in our medical clinic, including a full panel of lab work. And then they can have subsequent follow-up in our medical clinic for any issues that need to be addressed during their length of stay. In addition to that, for individuals that need more specialty medical care, for instance, we have some individuals who see a cardiologist or an endocrine specialist. For those that are based in the Atlanta area, we can coordinate appointments and ongoing care with the local providers. And even for our out-of-state patients, we can help to coordinate local providers in the Atlanta area, or at least correspond with their providers back home to make sure that their other medical needs and physical health issues are being attended to. And so, I say that to really hopefully highlight the comprehensive care that we provide at Skyland to our patients, and how we are particularly thoughtful with older adults, as we are aware that there can be more complexities and more at stake when it comes to maintaining function and managing both mental health and medical disorders. So thank you again for your time, and I'll pass it on to the next presenter.
Before I introduce Emily Wall, I just thank you for putting questions in the question and answer area. I forgot to mention that. We'll be doing Q&A at the end, so just keep on putting it in as Q&A chat area. So thank you. All right, Emily Wall. Emily Wall is our day service director. She's an LCSW. She is over our cognitive behavioral therapy track, our dialectical behavioral therapy, as well as a track that specializes in older adults with psychosis. She's also over our transitional housing program, our vocational services, and does a lot here at Skyland Trail. So I will turn it over to her.
Thank you, Nicole. And I'm really happy to talk about this topic today. Really, if you look at the types of therapy that we offer at Skyland Trail, the majority of patients 35 and up are probably going to fall into the cognitive behavioral therapy track. And this track is what targets depression, anxiety disorders, bipolar disorder, and sometimes personality disorders such as narcissism or dependent personality. And we are focusing here on modifying automatic negative thoughts, behavioral activation, and really just seeing overall how we can align someone's values with where they're trying to go in their life and in their treatment. The next kind of category that patients can fall into is our dialectical behavioral therapy track. And this track is more about regulating emotions. We have a 90-day DBT program. Often we see clients over 35 who may have self-harmed historically. There is some research out there about BPD and how it changes over time, over the lifespan. I would say if someone's over 50 and is on this track, it tends to be very interpersonal, and we're doing a lot of interpersonal work with them and their family. And so looking at getting through all 4 modules of DBT while they're with us. And then the third track, which is our social integration or CBT for psychosis track, really has 3 different presentations of patient that we work with. The first one is somebody who was diagnosed, let's say, with schizophrenia or bipolar disorder with psychotic features, schizoaffective disorder, when they were in their 20s or early teens. And they've had this long stability for many years after, getting on medications and learning about things then. And then let's say in their 40s or 50s decide to come off of their medication and have kind of a relapse of symptoms. And so sometimes they're coming in having a lot of education, but we need to get them stable again before they graduate from us. Another presentation is postpartum psychosis. We've had several clients come in, never having experienced psychosis or mood disorder, and then have a baby and that comes up. Then our third is really someone who has lived their life without a lot of mental health concerns, and then in their 40s, 50s, 60s, end up having the first episode of psychosis. And we do a lot there, I think, on the front end with Nicole and Dr. Meadows and admissions around getting, neuropsych testing or making sure, is there something organic going on there? We have had people who we've discovered, early onset dementia or other problems that are going on that need to be addressed. And we also have had folks who that is
genuinely when they have their first episode of psychosis. So really helping them gain education, learn how to cope, get on medication, and figure out what is going to work for them. And then for all of our tracks, couples therapy is huge. If someone is in a partnership or married, we really want to support them in having healthy relationships. So I put the Gottman method here just because if they have a short time frame, it can be like, oh, how much can you get done if they're there for 3 months or 2 months? And that, the assessment portion of the Gottman method is really helpful. They end up with a very thorough assessment of the relationship with kind of a roadmap to next steps. And that's something the family therapist does with them. And then they can take that assessment with them to further couples counseling. In addition to Gottman, though, we also do emotion-focused couples work, and then family therapy. And Dr. Bruce and his team are really great with this. I think he works from a family systems theory. That is very important. And also just recognizing the trauma in the family is something huge here. If someone has had a suicide attempt or lost their job, that impacts the whole family system. So how do we help them find stability in this next phase of life? And finally, for anybody with a substance use disorder, they would be in one of the 3 tracks above, and also in our dual diagnosis track. And that is getting them set up with a 12-step recovery model and really finding support and participation in a recovery community. And we do a lot of motivational interviewing and just ways to get them on board while they are simultaneously working on their mental health as well. So specific groups tailored to 35 and up. I think the first one, very important, healthy relationships in middle to late adulthood. We have now separated our relationships groups. This is a mixture of psychoed as well as support. So things like parenting come up here, taking care of family or aging parents is another thing. And then just family dynamics as well as couples dynamics and getting support from other peers, but also learning some concrete skills as well. And Doug will go into further the advanced vocational seminar and financial literacy that we offer. But I think these are really important topics for this age range. So usually clients come to us and they have already had a career. They might be using FMLA while they're in treatment, and they have to go back to work at some point. So we're trying to help them learn work-life balance. Maybe they want to do a whole career change. So how do we walk them through that? And so this group kind of helps them meet peers who are in a similar place, and then also gives them some concrete skills to take with them. And financial literacy, I just think that's such an important topic. A lot of research has shown, if you're 35 and up, the stress of finances is huge. So meeting the client where they're at, whether that's, working through debt, trying to work on investing and saving for retirement, or maybe they are getting ready to go into retirement and we need a game plan. So that is part of that group. And then meditation groups. I'll talk about in a minute some themes that are present in this population, but I want to just highlight meditation and the various ways that we offer this at Skyland to really see what fits for clients. So the loving kindness is really important, I think, especially if they have a depression diagnosis. And then participate mindfulness is more interactive. And then mindful meditation, more of like your standard, noticing the breath, working on body scans, staying in the present moment. And then grief and loss group. So giving clients a way to connect with others who have experienced loss. And then we also offer the group and individual pastoral counseling if someone's interested in that. with the focus being grief and loss. So themes addressed by individual and group therapy, a lot of these themes come from research with this population. So needing to discuss life transitions, how do they cope during a transition season? What is the current transition for them, whether that's becoming a parent, maybe having kids go to college, or moving in a career change. That is a really important thing to just address what comes up for them. And then grief and loss, as I mentioned, a lot of people losing relationships. The older we get, the more likely it is to occur. So how do we support them in that way? And then chronic pain is similar to what Dr. Meadows mentioned around using our health clinic to first make sure we're addressing any pain that is there, but also the impact of pain and illness medically on a patient. And how do they navigate just the medical field in general? It can be stressful, and how do we help them do that successfully? Social isolation, I'm still curious to see more research since the pandemic on what it's going to look like, but really socially, people are struggling right now. And we have many patients even here right now who entered retirement thinking like this is going to look a certain way. And the pandemic hit, and it has just been very isolated. And even folks who are not in retirement, but were working or, having to become a teacher to their kids for several years, that's a lot of stress. So definitely career and vocational stress leads into that financial health. And then there's a really great book, Cognitive Behavioral Group Therapy for Special Problems and Populations. And in that book, it talks about caregiving stressors and depression are kind of the two top problems for people who are really 50 and up. So dealing with aging family and maybe taking care of kids at the exact same time and having to navigate caregiving stressors. So we do this in a lot of ways at Skyland through groups that teach assertiveness skills and how to set boundaries on your time, but also how does self-care look in a really practical way when you have all these other things on your plate too. So thank you.
All right, next up, Shelley Dancer. She's our adjunctive therapist director. This includes art, music, horticulture, life enrichment program, family support, as well as our peer specialists. I always say that Shelley and her department and her staff is kind of the heart of Skyland Trail. And she's going to talk a little bit about it.
Right. Thank you, Nicole, and thank you for the invitation to be a part of this panel. I look forward to talking about adjunctive therapies at Skyland Trail. What makes Skyland Trail unique and stand out from other treatment facilities is the variety of adjunctive therapies that we offer. Horticulture, art, music, recreation, socialization, and enrichment activities are all an integral part in our clients' recovery. Paralleling Skyland Trail's holistic approach to health, our adjunctive therapies integrate social, leisure, recreation, and behavior activation activities into our clients' recovery processes to maximize their quality of living and strengthen their identity and their self-esteem. The success of beginning recovery from mental illness often lies beyond verbal therapy. While it is true that both verbal, individual, and group talking sessions are invaluable to their road to recovery, sometimes clients may not be ready, willing, or even able to verbalize their thoughts and feelings. Many people diagnosed with mental illness are very creative and have an underlying and compelling desire to be able to express themselves. Sometimes the key to opening their emotions is held within their creative and active being, which is activated and explored through nature, music, expression, exercise and movement, play and friendships, art and awe, and teachable moments. All of these things are happening within the adjunctive therapy activities. This is often an outlet that we learned in our younger years, and it's important to find the value of play and structure in activities regardless of age. They're important throughout the rest of our lives through wellness. Our clients participate in a variety of on-campus and community-based activities. And to name just a few, we've got gardening, nature through wings and rocks and sand, fairy home building and ingenuity. We have team sports, team building. We offer yoga and a variety of different exercise groups. We have 2 different forms of art, both product art and process art. We have music and talent, leisure education, mindfulness, creative writing and art journaling, independent skills, and practical self-care. We offer a group called Wellness Recovery Action Plan, socialization, and healthy relationships. Clients have an opportunity for self-expression and skill development, like managing their leisure time. They get to explore new leisure interests and reconnecting with past hobbies and interests that have maybe been put on pause because of their symptoms. Their engagement, that they learn new skills and interests that they can apply once they transition outside of Skyland Trail into their communities. Within our experiential therapies, clients experience joy and connection, celebration and pride, and a sense of community right from the start. I think about adjunctive therapies as being the color in a client's weekly schedule. Every day, we all need a break from our hard work. They're working on themselves, and oftentimes clients get to experience their break while they're in an art group, in a music group, or horticulture group, which allows them that glimpse of hope that recovery is possible, and that they're building the trust that they need within themselves and within Skyland, oftentimes first in an adjunctive group. I also want to share, we tailor each group and activity to meet the needs of all of our clients. We can and we do modify our groups, we adapt and we change based on somebody's abilities, interests, and engagement levels. I also want to share about our LEAP program. It's Life Enrichment Adult Program. The LEAP Evening and Weekend Program is our social enrichment program, offering a variety of opportunities to meet the needs and purpose and our clients through leisure and recreational activity. We have structured activities, and oftentimes in our enrichment program, our clients are coming in to reconnect to something that they've been doing in our clinical day services program. Through the arts and recreation, through special events. We went to Mental Health Day at the Capitol back in February, support groups. Healthy relationships are a vital aspect in recovery and living a fulfilling life, and because they are strengthened while in treatment, clients can leave treatment ready to carry these aspects moving forward. For more intentional engagement in activities and individualized attention, our older adults that live at our South Campus come at different hours on the weekends, where they participate in the morning hours, where our Rollins campus, which is for our younger adults, enjoy LEAP in the afternoons. I also just want to brief everyone about something else that's a unique adjunctive form of therapy is our certified peer specialist, by acronym that is a CPS. As you are learning today, we have a well-rounded, exceptional, multidisciplinary team. And as part of our clinical team, we have 2 peer specialists on staff who work alongside our clients and our whole clinical and staff community. A peer specialist is a person with lived experience who has been trained to support those who struggle with mental illness and or substance use. Their personal experience of these challenges provide peer support specialists with the expertise that is unique to their individual peer counseling and group facilitation. This is the process of giving and receiving encouragement and assistance to help our clients achieve their long-term goals. They offer, our peer support specialists offer emotional support. They share knowledge. They teach skills. They provide practical assistance, and they connect clients with resources, opportunities, and community supports. And I'm also wanting to share about our alumni program. One of our peer specialists here on staff is also the coordinator of our alumni program. It's called Alumni Connections. All of our clients discharging are introduced to our alumni program and are added to our alumni database, so they receive monthly emails and are strongly encouraged to attend by staying connected through the relationships that they've built while in treatment, to continue on with their support, the community, and enrichment activities. And so our well-attended alumni program is accessible to all through virtual and in-person enrichment opportunities. I'm just going to name a few. We've got weekly virtual support groups. We have monthly in-person outings in the community where we've gone to museums, we do bowling. We've got bi-monthly virtual enrichment where we do refreshers in dialectical behavioral therapy, cognitive behavioral therapy, the wellness recovery action plan, vocational, mindfulness, and self-care. And we have bi-monthly in-person outings, making flower arrangements, creative arts. They did prayer flags just a few weeks ago. And then we're building a recovery app right now, being able to connect through social media, and that being our main form of communication. And we get to do retreats. We've done a retreat in LJ, and we're getting ready to do Camp Twin Lakes. So the alumni program continues to grow, but it's great because we see relationships form here where we get to continue and carry those relationships with those clients outside of here. So thank you. I will pass it on to Doug. I appreciate the time.
All right. Next is our Assistant Director of Client Community Engagement. This includes vocational services as well as our transitional housing. So Doug is going to talk to you a little bit about that.
Thanks, Nicole. Thanks, everyone. I'm really excited to be here today. As though I enjoy my job in general, this population is actually my favorite to work with in our vocational services department. A couple of words about what we do logistically. Very often adults coming to us are employed, and so they may need to be working through FMLA paperwork, short or sometimes long-term disability paperwork as they're coming in. Very often, as they're leaving treatment, clearance to return to work, sometimes with accommodation, sometimes without. When Dr. Meadows is on the clinical side, he and I worked through literally hundreds of pages of such documents on behalf of our patients. And that's something that we offer them, both to make sure that they're getting the best services they can on both ends of treatment in terms of their job, and also to kind of relieve some of the stress. You know, when you're entering treatment and dealing with all those things, and then you also have your HR calling you about paperwork, it can be a lot. So that's one of the more logistical supports we offer. In terms of more clinical supports, one of the things that's pretty common with this age range is people coming to us saying, my job is the primary, or at least a primary reason that I'm entering treatment, or my career. You know, it's either a job that I'm in that is really stressing me out, or sometimes it's a job that I'm not in and that's stressing me out. Like, I can't find the job that I want. I can't find a career I want. I don't know what that would look like. And so very often we're trying to think through, on one hand, if you think of like a Venn diagram, or one circle is what does someone want to do? And the other circle is what is available to them. Where is there already overlap? Where can we create overlap? One of the things that often happens with this population, though, for people who have been employed, is that they come in saying, I'm burned out, I don't want to go back to that field. And so one of the tensions that we'll work through is you do have accrued experience and skills in that field. So as Emily mentioned earlier, as we have our slide here, is there a way that we can look at a different reframing of your work-life balance so that you don't have to completely move to a different field and start over essentially in that place? Is there a way that we can make what you're doing right now work for you? And is that advocating for yourself in your job? Is that looking for a different job in the same field? And in some cases, it really is the case that someone needs to make a career jump. And so looking for ways that we can take those accrued experiences and skills and apply them to a different field and kind of connect those dots for employers. Another place we look is financial health. Oftentimes, this sort of spans people who are maybe getting out on the younger end of mature adults. They're maybe getting out of paycheck to paycheck living and getting into, okay, how do I save? How do I plan? How do I invest? And then sometimes in the mid to older end, how do I actually become ready for retirement? And with that, we do have our financial literacy group. And we have actually a volunteer that comes in every week with us who is a retired financial planner from the Atlanta area and volunteers his time and just takes questions and provides answers based on that. That is an all ages group. So sometimes the questions are literally, how do I make my first budget? And it's very common for our older adults to come to that and have questions about longer term planning, like retirement. We had one woman in there fairly recently who was thinking about her own retirement while also trying to have money set aside for her parents' care, with her parents being in a position where they didn't have their own income. So really dealing with some really financially challenging things there. We also offer our advanced vocational seminar, which is really geared towards folks who are in that 35 and up range. And one of the big functions of that, before we get to the content, is just finding out that they aren't alone. I'm going to have a kids these days moment. I think a lot of our teenagers who are on TikTok come in and they feel that mental health and mental illness is well represented in their community, in the world around them, and they feel fairly comfortable identifying with that. Very often our adults, especially those who are mid to late career, feel very isolated, think I'm the only one who's going through this, no one at my job, no one in my friend group, none of those people know what this is. And coming to this group where they find out that other people are dealing with the same concerns of being mid-career and running into mental health challenges can be really helpful. As we move to our late career and early to any time of retirement adults, one of the things that we are sometimes looking at is the potential harm if there was a historic imbalance in work and life. You know, those people that like poured everything into their career and then it felt like a roller coaster coming to a sudden stop and they just kind of lurch forward and go, what am I doing now? And even if that wasn't the case, even if there was a fairly balanced presentation, you can all think about when you meet someone in our culture, it's pretty normal to exchange names and then to say, what do you do? And it can be so disorienting when you've had an answer to that question for 4 or 5 decades, and all of a sudden you don't. And so one of the things that we really look for ways to do is to support folks in this age range of defining their identity and their value and dignity separate from their career. And very often that takes kind of broadly 2 forms. One is, are there new areas of interest we can develop? You know, is there something you want to pour yourself into that maybe you didn't have time for while you were in your career? Another is, are there old areas of interest? You know, I had one retired woman who had a successful career as an accountant, and she told me that it was either accounting school or art school when she was deciding on college way back when, and her family pushed accounting and she went that direction, had a career, she enjoyed it, but now she had time for art. And so it was a very simple thing of getting her signed up for some art classes and developing some community there. So she had a thing to do and also people to do it with. Sometimes faith communities can be great resources here, volunteering at a synagogue or a church or a mosque or other place of worship. Sometimes providing care for family members, if there's grandkids in the picture, things like that. Volunteering, basically so that people have a way to think about what is it that I am doing, what is it that I'm offering, and also where am I being contributed to in the world around me. And so one of the things that's really important for us to explain to adults in this population is that though we do a lot with our younger folks of like, what do I want to be when I grow up? We also have a lot of really practical supports for folks who are already there, already in the midst of adulthood and of careers and figuring out what that can look like. At the same time, to wrap this up, we can also rely on some of the same interventions we use with our younger folks when someone is in a place of going, hey, I never really had a career. Like maybe there's someone who's had a lot of disruptions over the years from mental health and they've never landed one place. And we have a lot of interventions we can use there to help them nail down what might be fulfilling for them to do. One of the things we use is a strong interest inventory, which is an evidence-based assessment that really asks a lot of questions about what a person enjoys doing in terms of day-to-day tasks. And then from that generates a list of jobs that's going to fit with those interests. And I've seen so many people really turn a corner upon doing that assessment where they came in saying, you know, I'm not interested in anything, nothing appeals to me, no one would ever want to hire me, to looking through that assessment and going, oh, that looks cool. And then making a plan for making that happen. And that's also a really fulfilling part of this. So we really want adults in this age range to know that we really have their backs and really are prepared to support them in very practical ways too. So I'm really excited to be able to be on this webinar with everyone, and please drop any questions you have in the chat. Thank you.
Thanks, Doug. Danielle Green is our residential manager at South. Again, South is our residential campus for our older adult population, and she really creates a great community environment there. And she's going to share a little bit about what goes on at South.
At South, we hope to provide an environment that is safe and comfortable when people come into treatment. We want you to be able to engage in your treatment, but not live where you do your treatment. We want you to be able to participate in the activities, have your families to come and engage your children. We have at South a beautiful garden, a pavilion where families can come and visit, where children can come and play. We have visitation daily except for Tuesdays and Thursdays, and on the weekends for a long period of time. We also at South, to kind of piggyback off of Shelley, we do activities in-house on Fridays, things ranging from tie-dye to painting to making jewelry, to our Saturday activities where we get people out. For example, this weekend, we're going to Atlanta United. We want you to utilize the skills that you're learning in your groups and be able to use those in the community. So if you struggle with anxiety, you struggle in crowds, once your team and your primary counselor think you're ready, we want you to go to activities like that so you can utilize what you're learning. We also have a walk that we have a staff that does on Sundays to get you out as far as for exercise and things of that nature. Like I said, we want to provide an environment where you are comfortable, you are able to socialize, but you also have your own space where you can decompress, because we know treatment is not an easy thing to go through. And the staff wants to be as supportive as we can. Most of the staff that are at South have been there 10+ years or longer, and are very invested in making sure that people get the care that they need. And that is it from me.
Thank you.
You're very welcome.
Molly, do you want to help us through the questions?
Hi, I'm Molly Mercer-Dedman, and I'm the Education Director here at Skyland, and I'm going to moderate a couple questions. I think we have a time for a few today. The first one is directed at you, Dr. Meadows. Can you comment on differential treatment of so-called double depression, so persistent depressive disorder with concurrent major depressive disorder?
Yeah, thank you for that, Molly, and I appreciate the person who asked that question as well. I think here at Skyland, for both young adults and for older adults who come in for depression, we're seeing them during a fairly acute episode of their depressive illness. And so for individuals that have what is now known as persistent depressive disorder, which is I guess the updated classification of what used to be called dysthymic disorder, we would be seeing these individuals during a major depressive episode within their larger persistent depressive disorder. And so the bulk of our focus for those individuals is on recovery from the current episode in terms of restoring function and decreasing disability, decreasing symptoms related to their depressive illness. And for those with essentially some level of chronic depression or persistent depressive disorder, we are spending a good amount of time talking about prevention and talking about how to manage future symptoms or future episodes more effectively, and really borrowing a lot of the helpful knowledge and literature that comes out of the chronic illness and kind of chronic pain management models So having a balance of addressing kind of current symptoms that are getting in the way and planning for healthier management of future episodes.
Another question that we got is also for you, Dr. Meadows, and it's about TMS. So TMS, the question, we know that TMS can be offered at the Skyland campus, but for elderly, is it considered safer than SSRIs or atypical antipsychotics? And how does the efficacy and safety profile of TMS compare to traditional electroconvulsive shock therapy?
Yeah, thanks, Molly. And I'll start with the second part of that question. So thinking about TMS in comparison to ECT, also known as electroconvulsive therapy. A lot of the pioneering research around TMS was done here in the Atlanta area, specifically at Emory University, and TMS received FDA approval as a treatment for treatment-resistant depression back in 2009. So it's been on the market now for over 12 plus years, and we've been using it here at Skyland for about 6 years. And a lot of the research evidence and our personal experience here at Skyland, we see that it is equally as effective as ECT, and that's been proven multiple times within the literature. And it's considered a safer and better tolerated alternative to ECT. With ECT, oftentimes that treatment is happening in a hospital setting. It requires anesthesia. It requires someone to drive you to and from the procedure. And commonly, there's some level of cognitive side effects and sometimes other physical side effects that can occur during that procedure. Whereas TMS is non-invasive, does not require anesthesia, and is not known to have any cognitive side effects. The type of TMS that we do here at Skyland is called theta burst TMS. The procedure from start to finish takes about 5 minutes. So oftentimes clients are receiving it during their normal treatment day. They come here to our medical clinic in between groups and are on a schedule to receive the treatment and are able to finish it and go on about their day. When it comes to looking at TMS versus medications, that's a little bit of a more challenging question to answer because they're two different types of treatment. And TMS was really designed as an adjunct to medications and not a replacement of medications. So certainly we want to have a level of thoughtfulness in terms of medication selection to minimize side effects. But TMS, since it's a non-medication option, it's often very complementary to medications, but hard to compare kind of head to head in terms of safety and side effect profile.
Thank you, Dr. Meadows. Another question we got is for Emily. Emily, what is the most common admission diagnosis for mature adults?
So I think the most common by far would be somebody with depression, and usually not just depression, but an anxiety disorder as well. And usually clients in this age range are on our CBT track. I'd say that's definitely most common. Next would probably be DBT. And then from there, the CBT for psychosis track is a little less common. And I also did notice maybe one other question just around like treating complex clients. And so I think I just want to throw out there that most of our clients are pretty complex. And, I don't think that's just because we look at them holistically, but even the clients that come in with depression, typically the underlying question we want to answer is like, why is this client not able to get better using standard outpatient treatment? And typically that's for a host of reasons, whether it's like a really, long-standing core belief that has gotten in their way of being open in therapy. Sometimes it's stigma just of being vulnerable and really saying what's going on to their outpatient provider. But overall, I'd say, we're able to kind of get down to getting them to the point where stepping back down to outpatient therapy, typically on CBT, would be the thing.
Thanks, Emily. All right, we have time for one more question, which leads us to really our next slide. Nicole, can you talk about the admissions process, and would clients need to go through a crisis stabilization unit for long-term treatment?
Sure, I can talk about admissions process. So admissions, usually typically starts with a phone call, and that can be from a provider, from the family, and from their client themselves. We are not an inpatient unit, so someone who needs stabilization would first need to go to a hospital and then kind of work on transferring into our program. We're really about records, so we want records from their outpatient provider. If they're inpatient, we're going to want those records, and then we do an assessment of the client, and that can be a phone assessment. We've done Zoom before, and in person, the full psychosocial with the client, talking about symptoms, treatment history, but also talking about our program, answering their questions, talking about their goals, to make sure that this is both clinically an appropriate program. They want to come into treatment here. Another thing is want to just kind of put out there, we are in network with most major insurance companies, including Blue Cross Blue Shield, Cigna, United Behavioral Healthcare, Aetna, and also TRICARE East. Julie mentioned that we do have a financial aid program that can help clients who insurance isn't authorizing treatment or kind of need a little bit more supplement with our financial aid program.
Well, I'd like to thank my colleagues for taking time out of their busy schedules to share their expertise with all of you today. And again, thank you all for taking time out of your schedules. We're glad you were able to join us. And we are excited to announce that we have resumed on-campus tours of both the adult and adolescent campuses. And we'd love for you to join us for an adolescent campus tour, which is going to be held on Friday, April 14th from 1 to 2 p.m. Again, you can access our website, skylandtrail.org, for information about our events, programs, and services, as well as the recording from today's presentation. Thanks so much, and have a great rest of the week.